Counselor Interview by Heather Dunn. I interviewed Jennifer Byford, who is a licensed counselor, and her license number is 82807. She holds a Master of Psychology and Counseling degree from LeTourneau University. She graduated in December of 2018 from a non-CACREP accredited program. She is a member of the American Counseling Association and the Permian Basin Counselors Association. I asked her what are the rewards and most fulfilling aspects of being a counselor, and she said that it's a way to help people with her spiritual gift. Being a counselor allows her to help others, but with boundaries. When I asked her what the biggest challenges and frustrations of being a counselor were, she said that the biggest challenge of being a private counselor is the time and money. These challenges prevent her from seeing people as much as needed or even at all. When I asked her what her views on counseling as a profession were, she said that counseling as a profession is a worthwhile profession. It would be difficult if she were the sole provider of her family, and she thinks that it's an incredibly honorable career to meet people who are in the hardest parts of their lives. She considers it holy work, helping people to mend where sin has come in, even though she's not perfect at it herself. I asked her about overcoming burnout and maintaining wellness, and she shared that helping others with life problems can be a worthy career choice, but it also is a heavy burden. Counselor Interview by Heather Dunn. I chose to interview Jennifer Byford. Her license number is 82807, and she holds a Master of Psychology and Counseling degree from LeTourneau University. She graduated on December 8th of 2018 from a non-CACREP accredited program. She's a member of the American Counseling Association and the Permian Basin Counselors Association. When I sat down and asked Jennifer what are the rewards and most fulfilling aspects of being a counselor, she shared with me that it's a way to help people with their spiritual gift. Being a counselor allows her to help others, but having some boundaries. When I asked her what the biggest challenges and frustrations of being a counselor were, she shared that the biggest challenge of being a private counselor is time and money. She said that the challenges prevent her from seeing people as much as needed or even at all. When I asked her what her views on counseling as a profession were, she said that it's a worthwhile profession. It would be difficult if she were the sole provider for her family, but she thinks that it's incredibly honorable to meet people who are in the hardest part of their life. She considers it holy work and helping people to mend where sin has come in, even though she's not perfect at it herself. I talked to Jennifer about overcoming burnout and maintaining wellness. In the ACA, it talks about helping others with life problems can be a worthy career choice, but it also is a heavy burden. It states, I realize that burnout and compassion fatigue are real issues that affect many counselors globally. And while our lives cannot be free of stress, as counselors, we must be aware of how to take care of ourselves. Some ways that Jennifer avoids burnout is by doing continuing education. She also joins organizations. These organizations help with burnout because it allows her to be around other professionals that understand her line of work. Another way that she avoids burnout is not working full-time. She has days of solitude, and that was not a practice before becoming a counselor, and working part-time affords her that. Jennifer also says that pressing into emotional, spiritual, physical aspects helps her to maintain wellness for herself. She states that working out is not an option and that it allows her to maintain wellness for her body as well as her mind. She also pursues things that are joyful. She's currently learning how to play the keyboard and says that she's not great at it, but she enjoys it. Spiritually, Jennifer states, I want to be healthy for my clients. Self-care is no longer optional. It's required for me to take care of my clients. On the preferred techniques, I asked Jennifer, and she said that she believes that all counselors need to pick a trauma orientation. Trauma-focused cognitive behavioral therapy is her preferred technique. She loves it because it's research-based and offers a framework. She states, if a client has certain symptoms, then she can reference and be likely a success. Jennifer sees herself as person-centered. She likes to work with what her client brings to the room. By doing this, she's helping them through their trauma instead of leading them. When I talked to her about community needs, she said that what I see is as a need is we have a lack of providers that accept Medicaid, and really a lack that see children and adolescents. These populations go underserved here in the Permian Basin. So this goes back to time and money. A counselor can also run into ethical issues when a client is trying to pay cash, but they have Medicaid. This is a real problem for the federal government to solve. Jennifer's clinical name is Erin Byford Counseling, PLLC. Jennifer serves children, adolescents, and adults through talk therapy. She does not see clients with significant cognitive or speech impairments, and she's found her niche by working with adoptive parents and adoptive children, siblings who adopt siblings in family therapy settings. Adoptive and foster counseling happens organically for Jennifer because she is an adoptive mom. Jennifer would love to develop groups. She states that time is a hard thing for groups. She's done spiritual formation groups, and she would love to do adoptive sibling, parent, and teen groups, but it's hard to get people to commit. She partners with Grace Christian Fellowship, which is also her home church. She sees staff and church members pro bono or at an extremely discounted rate. Her practice consists of herself, a CPA, and an attorney. She has 2 therapists that she consults with on a regular basis and sees about 12 to 20 clients on a 2 to 3 day work week. Her hours are 8 a.m. to 6 p.m. Tuesday through Thursday, and sometimes she will meet clients outside of those hours. Jennifer is working on a professional will. She states that for community disaster, she would offer her services and that she is also able to do that through the Permian Basin Counselor Organization. I talked to Jennifer about her worldview and spirituality, and Jennifer says of her worldview, I see the world through a lens of Christianity. She is a culturally a white middle-aged mother with a background in education. She values learning and feels that psychoeducation is a big part of learning. She also believes being an adoptive mom has shaped her worldview. Because her office is at the church, a lot of clients that find her are interested with a Christian perspective. She does not consider herself a biblical counselor, but lets clients integrate their faith. She wants their counseling informed by a biblical background. And she states, being a believer holds me to a higher standard of not doing my work for personal gain, but for the Lord. She says that she does not interact with non-Christian clients differently than her Christian clients. And she says that the content of her therapy may be different, and she has worked with clients that use crystals for mindfulness. She allows her clients to choose. She says a lot of times teens don't want faith. She says that while she sees her work as holy, she does not let her work and her faith overlap. She lets others see Jesus in her. It's not my job to create disciples in counseling sessions. Jennifer's beliefs in this area coincide with the ACA Code of Ethics, Section A 4B. Personal value counselors are aware of and avoiding imposing their own values, attitudes, beliefs, and behaviors. Counselors respect the diversity of clients, trainees, and research participants and seek training in area with which they are at risk for imposing their values onto clients, especially when the counselor's values are inconsistent with the client's goals or are discriminatory in nature. My personal thoughts and perspectives. I love Jennifer's clinical setting. Her space is inviting and warm, and the way that she sits with her clients makes it easy to be comfortable. She also has a white noise machine outside of her door so that those passing by are not able to hear the conversations that are taking place. I love that Jennifer sees a variety of clientele. I believe that the difference in those that she sees allow her to keep learning and helping other patients. Jennifer has been a great resource and encourager for my decision to become an LPC. I've been encouraged by her therapy model of CBT and understanding that my own past does not mean that I would be a bad counselor. I now understand having trauma of my own can help me be a more effective counselor, and I'm even more excited about my career path after interviewing with her. The resources that I used are the American Counseling Association Code of Ethics and a article titled Recognizing Burnout and Compassion Fatigue Among Counselors, and also a personal communication.